I'm Michael Betel, president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, as part of our patient-focused series, Liver Insights, Illuminating the Path Through MASLD and MASH, I'm excited to introduce my good friend, Dr. Naim Alkhouri, who's a transplant hepatologist and the chief medical officer and director of the Fatty Liver Program at Arizona Liver Health in Phoenix, Arizona. In part 7 of our special series for patients who have already been diagnosed with MASLD or MASH, we'll be discussing treatment options and innovations. Our discussion today will be focused on current and emerging treatments and what patients need to know. Dr. Curry, there's a lot of stress in the lives of patients who have been diagnosed with MASLD and MASH, but there's hope because there are treatments available today and new innovative approaches being studied every day. You are deeply involved and care deeply for patients in your clinic. I've met your team, an amazing team. And what can you share with us today about treatment options for patients?
Well, thank you for having me, Michael, and thank you for all you do to raise awareness about fatty liver for our patients and providers. I really appreciate you. Today is a very exciting day for all of us in the fatty liver space because just a few days ago, the FDA approved the first drug for MASH and patients with stage 2 and 3 fibrosis. So this is what we call at risk or high risk MASH. The medication, we've been working with it for a few years now in the context of clinical trials. It's called resmetirom. The brand name is Rezdiffra now. We have several medications in the pipeline that are in what we call phase 3 clinical trials. So this is the last step before FDA approval. I'm very excited to be with you today specifically to discuss what we can do today for our patients, but also in the near future and how this field is going to shape up. Having said that, I think lifestyle interventions and making sure that we spend enough time discussing with our patients how to implement these changes to try to lose about 10% of their total body weight is still very important in conjunction with any of the new treatments. So we should never forget about this. The last message we want to convey with the new medications is that there's a pill now and you don't have to worry about lifestyle changes. That's not the idea. And actually, if you look at the FDA label for the first drug, it states clearly that this medication should be taken in conjunction with lifestyle interventions to induce weight loss. So that's an important message. But a lot is going on, and I'm very excited.
I would love to see some more information that you could share. I know that you prepared a few slides, and maybe that would be great visually just to show some of the pipeline and what's happening and other options that patients have.
Absolutely. I'm happy to share. Um, just give me 1 second to be in presentation mode. Can you see my slides?
Yeah, perfect.
All right. So I just wanted to discuss, the treatment options and some new innovations, what we have today, and then emerging treatments. And this is really directed to our patients. So what they need to know and what issues they can bring up to their treating physician. So first, I'm going to discuss options for achieving that 10% total body weight loss. I think this is the goal for all patients with fatty liver disease. So, I want to start with that. Then I would like to spend a couple minutes just discussing the first FDA-approved medication for fatty liver with fibrosis. It's called resmetirom or Rezdiffra. And then I want to discuss emerging treatments that are in late drug development. So this is what I call the weight management spectrum for patients with MASLD or fatty liver. And I want our patients to be familiar with this, that you have many options. It's not just a lifestyle intervention where you meet a registered dietitian and you have to follow a diet. This is always a good first step. But then there's also apps for weight loss, what we call digital therapeutics, and they can be very engaging and provide many recipes and exercises and using the concept of cognitive behavioral therapy. So that's one option. I also want our patients to know that we have several what we call anti-obesity medicines. These are drugs that can be oral, like phentermine in combination with other medications, naltrexone, and then injectables. And these are more effective, including medications like semaglutide, tirzepatide, These are usually weekly injections, and they mimic some of the hormones that we make in our body, decrease appetite, delay the emptying of the stomach. And again, if you have MASLD, we have very good preliminary data showing that these medications will help achieve that 10% weight loss, and potentially they have good effects on reducing liver fat, liver enzymes, and liver inflammation. And then we have also procedures. These can be done endoscopically. So there's a new field called bariatrics. So these are like stomach balloons. You can also have kind of like a sleeve gastrectomy, which is basically stapling the stomach from the inside to help with weight loss. So this is kind of getting bariatric surgery, but without the surgery, just through a scope. And then we have what we call weight loss or bariatric surgery. And that's also a good option for some patients. So again, if you're struggling with weight loss, I want our patients to know that it's not just you, and it's really not about willpower and just eating less. There's so many factors that play into it. And discussing with your physician what are the best options for you, very important. And again, your physician should be also familiar with these options. And I just wanted to provide our patients here with how much weight you should anticipate to lose on average. With lifestyle changes alone, we lose between 2 to 5%. Of course, we have patients that are way more successful than that, so I don't want to discourage anyone, but these are, studies looking at averages. And then when you add the oral anti-obesity medicines, you can hope to lose between 5 to 10%. But then once we get to the injection medications like semaglutide, tirzepatide, you see you lose between 15 to 20%, which is encouraging. And then with bariatric endoscopy, bariatric surgery, the weight loss can be up to 30%. And again, the key is we want to utilize these in combination, and we want to train physicians to become more familiar with prescribing anti-obesity medicines, but also recommending bariatric procedures, and most importantly, being comfortable sitting down with their patients, discussing lifestyle interventions and how to implement them. So in terms of the target population for the new drugs, I wanted to highlight this, and I don't want to make this too complicated, but I think it's important for our patients to understand that the majority of patients with fatty liver disease do not need to be on a drug. What they need is really to lose weight, and that should be sufficient. So the drugs are being developed for patients that have MASH, which is fatty liver with inflammation, plus scarring of the liver, what we call fibrosis. So we have 4 stages for this fibrosis, with the last stage, stage 4, is cirrhosis. And the medications that we are developing, they're going to be FDA approved initially only for patients with fatty liver with inflammation, or steatohepatitis or NASH or MASH, plus stage 2 and 3 fibrosis. So you don't need the medicine if you're too early in the disease and you have no scarring, okay? That's important. But also if you're too advanced and you have cirrhosis, we don't know if the medicine is going to help with cirrhosis. We're doing trials now. And that's why it's so important, if you're told that you have fatty liver disease, you need to ask your physician how severe it is, what stage I'm in. Because again, if you're stage 0, 1, that's different management than stage 2, 3. And then if you have cirrhosis, this has many implications. You become at risk for liver cancer, you need regular screening, you need endoscopies. So this is maybe the most important message today, that if we have any patients with fatty liver disease, but they just tell you you have fatty liver, you need to know what stage you're in. And there are many things that you can do to find that stage, from simple blood tests and calculations we can do from your blood test, to imaging tests based on ultrasound, MRI, and we can tell the stage in almost 95% of patients without needing any invasive biopsies. Now, in terms of approving drugs, the FDA accepts 2 what we call endpoints in a clinical trial. And these are what we call a resolution of this NASH or MASH, which means that you have no liver cell injury and only minimal inflammation, or a regression in the scar tissue stage. So if you're stage 3, you need to go to stage 2. If you're stage 2, you need to go to stage 1. So this is just, for people that are developing drugs, this is what the FDA will approve. So, and I wanted to highlight this for our patients, because when we discuss the efficacy data, this is what we report in clinical trials. What percentage achieved the NASH resolution? What percentage achieved the scar tissue improvement? And we have several drugs. And the first one I mentioned is resmetirom or Rezdiffra. It's FDA approved. This is an oral agent. This is also followed by another medicine called lanifibranor, which is in phase 3 development. And there is a chance it could be FDA approved in 2026, 2027. And then we have injectable drugs, including semaglutide, which is the same drug as Ozempic or Wegovy. So semaglutide is being tested for NASH. This is in phase 3. We anticipate the readout of this phase 3 trial by the end of this year, early next year, which can mean FDA approval in 2025. So that would be exciting. And then fructifermin is a hormone that we make in our body. It's called FGF21. But for simplicity, it's another injection you do once a week. It's also in phase 3 trial. And actually, there's several medications now that should be entering phase 3 in 2024. So that's exciting. So I just want to show some data on the efficacy of this new medication called resmetirom or Rezdiffra. And remember, we talked about the NASH or MASH resolution rate. So this is, again, less liver inflammation, less liver cell injury. And with the treatment, you can see that up to 30% of patients achieved this NASH resolution. And that was only achieved in 10% in the placebo arm, which is basically the patients taking a sugar pill instead of the active medicine. So you can see that there is, this differentiation by about 20% with resmetirom. And, this is very exciting for us. This is after 1 year of treatment. And then when we look at regression of fibrosis going from stage 3 to 2 or 2 to 1, this happened in about 25% of treated patients, and this was better than placebo. This is a big deal because in my clinic, patients always ask me when I say you have scar tissue, you're at stage 3, they always ask me, is this reversible? Is it too late? And what we are showing here that yes, this is reversible, and this is actually reversible with lifestyle and weight loss if you lose enough weight, but also with the medication. And again, the idea is we're going to use the medication in conjunction with lifestyle. So very encouraging. Of course, every time I talk about efficacy, my patients ask me about safety and what should I expect in terms of side effects. And if you look at what we call serious adverse events or SAEs, these were not that different from placebo, so that's reassuring that the drug is safe. But there are two side effects that you should anticipate with this medication, resmetirom or Rezdiffra. One is diarrhea, which happens definitely more in the medicine arms than the placebo, and also nausea. But again, the rate is about 1/3 of patients will develop diarrhea, and up to 20% of patients will have nausea. And these are two side effects I'm going to discuss with my patients even before they start taking the medicine, because we can manage them easily with certain medications like Imodium and Zofran as needed. And the good news is they happen after 1 week of taking the medicine, but typically they disappear between 2 to 4 weeks after you take the medicine. Most people tolerate them. The diarrhea is not severe, it's just loose stools for the vast majority of patients, and the nausea is managed. We have other medications. I don't want to get too technical here, but I just want to show you some data with lanifibranor. This is another pill once a day, and we tested it in 2 different doses in this clinical trial. But if you focus on the high dose, which is 1,200 milligrams daily, they achieved that NASH resolution. They achieved the improvement in fibrosis, and in many patients, they achieved both NASH resolution and fibrosis improvement. So this is encouraging. Semaglutide, this is the injection once a week. We use it already for diabetes and obesity. In one trial, they showed that up to 60% of patients on semaglutide can achieve that NASH resolution. So that's also encouraging. And then we have that fructifermin drug that I mentioned. And in this trial, they showed that after only 6 months of treatment, up to 75% of patients achieved this NASH resolution, and up to 40% of patients achieved the regression in fibrosis, and this was twofold better than placebo. So very encouraging data as well, and this is in phase 3 development. So, for our patients, and hopefully we'll have many, many options in the near future before 2030. This is what I call the MASH medication scorecard. If you want to compare medications, This is more for clinicians, but I just want to show you what we are trying to achieve for you in the context of drug development and what we want the drugs to achieve. We want a drug to achieve a very high rate of NASH resolution, fibrosis improvement, reduction in liver fat on MRI, reduction in liver enzymes. We also want medications that will help you to lose weight, improve your cholesterol and triglycerides, and help you with controlling diabetes or prediabetes if you have these conditions. We also want medications that will change your lifespan and prevent you from developing liver death and liver complications like turning jaundice in the eyes, yellow, accumulating fluid in the abdomen. These are bad complications. But we also want to help you reduce your cardiovascular risk and decrease the um, percentage of patients that will unfortunately die from heart attack and stroke. And then every time we develop a drug, we keep an eye on the adverse events and side effects, and of course costs. So these are, the goals. And ideally, we want to get to a drug that's effective in close to 100% of patients with no side effects that will help you also lose weight and improve your cholesterol and diabetes. So with this, I'm going to stop the slide presentation, and I am more than happy to take any questions from you, Michael, if we have any attendees online. Thank you so much for the opportunity. I'm going to stop sharing my slides.
Thank you so much, Dr. Alkhouri. What great presentation, great overview of what is and what's going to be hopefully one day too. So there's hope for patients and physicians. I wanted to ask you about patients might want to know about monitoring. So how do they know whether it is through lifestyle management, weight loss, as you said, maybe it's 5, 7, 10% weight loss, and or if they get treated with a medication, how do they know over time if it's working or not?
Yeah, that's an excellent question. So, we utilize what we call a non-invasive test at baseline to determine who needs to be on treatment. And things we look at in every visit, liver enzymes, AST, ALT. We measure these routinely, simple blood tests. We also have imaging tests that can help us determine how much scar tissue you have in the liver, such as FibroScan, Velicure machines. It depends on what office you go to. Even a traditional ultrasound machine may have ways to determine how much scar tissue you have, and then we can follow these over time. We can also determine the amount of fat in the liver with ultrasound or MRI technology. We also have blood tests for, scarring in the liver. For example, in my clinic, we utilize a test called enhanced liver fibrosis or ELF. This is a blood test. And we also have some newer blood tests that we are getting experience with now, including something called OWL liver or one-way liver, a test called liver FAST. FAST stands for fibrosis, activity, steatosis. We anticipate to have another test called NIS2 plus. So I don't want to get too complicated, but I think to simplify, we have blood tests that tell us about liver inflammation. We have ways to determine the amount of liver fat and scarring, and we just follow these over time. And in experienced hands, I think you can be confident that the medicine is actually doing what it's supposed to do for our patients.
Many of the patients may have been involved in previous studies or trials, let's say, and so they may have had to have a biopsy, but that's not a requirement now, correct? Right.
Yeah, I would say the vast majority of patients will not require a biopsy to qualify for a clinical trial or to be on the new treatment. And actually, in the FDA prescribing information, the FDA label, there is no mention that you have to do a liver biopsy. But they make it very clear that the new medicine is indicated for patients with NASH plus F2, F3 fibrosis, and they do not recommend that you use it in patients with cirrhosis or patients with less advanced fibrosis like stage 0 and 1.
Thank you. Very clear, exciting times ahead. I'm sure your patients that you see every day are going to be thrilled that there's options for them. So thank you so much for today, and we'll definitely make sure that the word gets out with regard to treatments that are in development, and we'll speak with you again soon too.
Thank you so much, Michael. Keep up the good work. And this is really the time to raise awareness because we don't want anyone to be living with stage 2 and 3 fibrosis and not know about it and find out, 5 or 10 years from now that they have cirrhosis. So Again, appreciate everything you're doing.
Early awareness, right? Thank you.
Yeah, yeah. Thank you.